And welcome to our live stream at Deuk Spine Institute, Surgery Center Vieira, here in Melbourne, Florida, on the Space Coast, where we are minutes from NASA and the launch pads for the space shuttles and SpaceX. Lay still, okay? Our patient today has had a prior fusion, which you'll see when you look at his imaging. Did you inject? Yeah. And you're going to see that screws and rods at L3-4, that's L3 and L4. He's had a fusion done at L3-4. I didn't do the fusion, somebody else did. But he now has what's called adjacent segment disease. And specifically, he's having pain at L5-S1. That's right down here. We're going to go in there and fix that. So I'm going to give you a little numbing medicine. Lay still, everything's okay. I'm just giving you some numbing medicine. Our patients are awake for the lumbar and thoracic procedures. It's probably higher than that, huh, with my luck. And because they're awake, I need to try to keep them comfortable as much as possible while we're accessing the discs that need to be fixed, because they are awake after all. We're going for the L5-S1. A little bit lower than we want to be. Oh yeah, that's nice. Pretty close. Shot? Uh-huh. We're right there. That's great. Shot? All right, beautiful. Let's get an AP. So we're going to alternate between a side view and a front back view. We call the side view lateral, front back view AP. So you'll hear me use those abbreviations throughout the surgery. That's beautiful. So we're right at the side of the disc there. And there's a lot of arthritis here, I can tell you that for sure. You can see the screws and rods, right? And that kind of screws and rods is called a cortical screw fit configuration. And there's only, the doctor who came up with that configuration actually practices just down the road from us, about 30 minutes away. I do not recommend that type of fusion. We don't recommend fusion anymore at all. Are you awake?
You doing okay, my friend? Huh?
Are you doing all right?
He's doing fine. You having any pain in your legs? Any pain in your legs? No. He said no.
So we're down at 5-1. We're going the wrong direction with the needle. All right, so the bone spurs were forcing me up, and I don't want to go up. I want to go down. So let me think this over. I may have to come in with a higher approach. That's what I think I'm going to do. Come in from higher up and try to get a different angle of attack, we call it. Good. You're doing great. Just hang in there. Bear with me. So I want to enter the L5-S1 disc, in such a way that I'm able to get into the disc. That looks better. AP. And not affect the nerve roots around it. So the thing we have to be careful about, there's lots of things we have to be careful about. One of them is the nerves that are leaving the spine right where we are, just above where we are. Are you comfy?
You comfortable, my friend?
So it's important my patient during the beginning of the surgery is awake to help guide me.
Any pain at all?
We're sort of partners on this, getting into this disc. We're partners. He needs to help me get into the disc safely. Shot? All right, so it's looking better and better. It should be pretty darn close. Yeah, I could feel it. Pretty collapsed disc space. Shot? All right. Now we're definitely in. You could see the deflection of the end of the needle. AP, actually, let's just go with this. All right. So this patient presented to me complaining of back pain. Oh boy. And when I asked him, where is your back pain in the clinic, he showed me that it was right here, right here. This is the spot. Well, what's here is the L5-S1 disc. Now there's a disc above it called the L4-5, which is right about here, but he was pointing X marks the spot. All right. Is he reliable?
How you doing, my friend? You okay? He said okay. He's okay.
Are you comfy?
Are you comfortable? Are you comfortable? Yes.
Did you take any pain medicine today?
No.
None. I gotta talk loud because he's under the drapes, so.
And he has a mask.
Oh. Shot. Come on, Jordan. And what are you waiting for? An invitation? Well, the dye just flew out and it's already gone. Shot? I don't see it. Give me an AP. So the dye literally just went in the disc and out immediately. All right. Let's do another tube. Another dye. Really? Never mind. No. You have more available? How long is it going to take? Never mind. You guys need to be prepared. It's too late. So as I try to do the discogram to confirm this disc is painful, the dye literally just, instead of going in the disc and being held in there like we typically see, it literally just came out. We can go ahead and put him to sleep. It just came out immediately through a giant tear in the back of the disc, which supports that he has an annular tear that's quite large, but unfortunately we weren't able to confirm the pain. I'm going to make a small incision. Our patient is going to be put to sleep. So for the rest of the surgery, he'll be out. My anesthesiologist is working on that right now. Meanwhile, we're going to get started. Let's do some num-num. You're doing great. Hang in there. The num-num is just some Novocaine, Marcaine, lidocaine, standard numbing medicines that help ease the discomfort of the procedure in the muscle and subcutaneous tissues. Sean? So I could feel we're at the back of that L5-S1 disc. There's a lot of arthritis, bone spurs around here, none of which need to come out, but they're just there, making it harder for me to do my job. All right. So far, so good. Take the guide wire out. Yep. He's pretty collapsed at this disc. Hold on. Tell me where we are. Sedated? No. I want to get the muscles in his back totally relaxed so that we can, get in and go ahead. The problem, if patients are not asleep enough and they're uncomfortable from the procedure, they'll tighten up all their muscles in their back. And what that does is it makes it impossible for me to get into the disc easily. I have to use a lot of more force to get the tube in. That's looking pretty damn good, huh? That's it. All right, we're inside the L5-S1 disc at this point. We're going to take the dilator out, just leave the tube in. So far, everything's going well for this gentleman. My goal is going to be to get to the back of the L5-S1 disc where the tear is and use the laser to clean the tear. It's called an annular debridement. And in doing so, we should get rid of his back pain. So right now this tube, can you see this here, Henry?
Repeat that one again. I'm sorry.
Can you see the tube?
Yes, we do. Yes.
Right now the tube is going into the back of the disc at L5-S1, and we're going to be fixing this disc with the laser in just a moment endoscopically. Let's run the video showing the audience why is it that disc problems, injured discs actually cause back pain. How do injured discs cause back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, welcome back. We are now looking down the tube. At the end of the tube, we're inside the disc. You see that? We're inside the L5-S1 disc. And what we're seeing, all that red stuff is inflammation. Inflammation. That's a great picture there, Henry, for our catalog, for whatever you want to call it, our work. Let me see if I can get it less blurry. That's as good as I can get it. But go ahead and get a picture of that one and save it. You can see the inflammation in the annulus, and you can see the inflammation of the end plates right there. That's an inflamed end plate. This is a good one. All right, so lots of inflammation at L5-S1. This is where his back pain is coming from. The only reason I couldn't confirm it on the discogram was because the disc has such a massive hole in it that it just let all the dye out. You can still see a little blue staining there of the nucleus. Now, unfortunately, when you have inflammation, you have blood vessels and blood supply, which is good in a way. Kind of gets the disc to heal a little faster. But the truth is, with all that inflammation, you have a lot of blood vessels, you're going to have some bleeding. So the more inflamed the disc is, the more hemorrhage you get. These are pieces of herniation right here that I'm removing. Now this technique you're watching is called the inside out technique. It was taught to me by Dr. Anthony Young, a pioneer in endoscopic spine surgery of the lumbar spine, probably the most influential surgeon in the world, in my opinion, the most influential in the world for lumbar endoscopic surgery. And Dr. Young has been doing, he's retired now, but he was doing endoscopic surgery on the lumbar spine, similar to what I'm doing. He called it the YES technique, Y-E-S-S, and he is not practicing anymore, but he's still a good friend and advisor, and he's probably the most prolific publisher of all surgeons in endoscopic spine surgery that I know of. Of course, that's changing as more surgeons in Asia pick up the endoscopic surgery technique. India, China, Korea. There's very little adoption of this technology in Europe and America because the United States is so heavily controlled in spine by the companies that do fusions, that sell the fusion devices. and they don't want to lose that business. So they're out there promoting their fusion surgeries, the artificial disc surgeries, where they make all their billions of dollars profits. Instead of promoting what's best for the patient, they're promoting what's best for their companies. And they're in cahoots with the insurance companies. They're in cahoots with the surgeons and the hospitals. They're all basically there to make a buck off of the patients. And unfortunately, the surgeries they recommend are very dangerous. And just like we have an opioid crisis, we have a spinal fusion crisis. Okay? And we need to have a war on unnecessary spine surgery that doesn't work. Just like we had a war on opioids. Like opioids kill people, right? It's not half as many people as are killed with spine surgeries that are bad surgeries, unnecessary surgeries. We need a war on unnecessary bad spine surgery. That needs to be the next war. Okay? And I think it's coming. The insurance companies have already tested the water for this war years ago when they started publishing articles in the New York Times about how greedy spine surgeons just want to do spine surgeries that don't work. They tested the waters. They got a pushback. They measured the pushback. They measured the defensive efforts, which were pathetic, by the way. And they're going to come back, trust me, they're going to come back very soon. And they're going to basically say all this spine surgery that's being done is all experimental and unnecessary. Okay? And honestly, I'd have to agree with them to a degree that the fusions are unnecessary, the artificial discs are unnecessary, the laminectomy is unnecessary and experimental. Okay? But the Deuk laser disc repair is not. That is your best chance and your best surgery to get rid of back pain. All right, any questions from our audience?
No current questions, but we do have a comment from Brandon on Facebook
Sure.
saying, "Hey, Dr. Deuk, hope you are doing great. I'm tuning in from Jacksonville. And wow, 80 years old. I'm sure he will appreciate the relief after the surgery for sure."
Yeah, thank you. So thanks so much for checking in with us from Jacksonville, and I appreciate it. Yep, everything's going well. You can see how collapsed this disc is, right? I mean, it's so collapsed, and where there's really not much left here. But the stuff that's left is causing all the pain. So we're going to get rid of this pain stuff, pain generator. We call it a pain generator. That was a term that was introduced to me by Dr. Young, who we were talking about earlier, pain generator. And it's an important term that people need to understand. What it means is something in the body that's making pain, right? And we already know that pain generators are real, right? If you have a pimple on your face and it hurts, well, it's generating pain. That pimple is the pain generator. But pimples aren't the only thing that cause pain. And certainly the spine has pain, back pain, neck pain, right? And the question is, where in the spine? I'm not able to get to 12 o'clock. Where in the spine is that pain coming from? And that's what we figured out at Deuk Spine. We've discovered the source of pain. And now that we know where it's coming from, we're using this amazing surgery to treat it, to get rid of it. You can see all the scar tissue I'm dealing with right here. Between the bones, you're literally looking at the disc pretty much at this point from the outside in, right? Because we've pulled back far enough. We're actually outside the L5-S1 disc. And we're looking at the back corner of it. And right here is just a bunch of scar tissue and herniation. But you can see how collapsed the disc is. I'm trying to stick that probe in between the bones, and it won't go. So we're really at the back end of the disc, and I'm just going to finish treating this back area where the pain fibers are, and we're going to be done. We got less than 5 minutes. That's a giant bone spur right there. People ask me, can the laser get rid of bone spurs? Well, that's a bone spur. You tell me. We just got rid of it. So yes, The laser can get rid of bone spurs. The thing is, you don't need to get rid of all your bone spurs because they're not causing problems. Only some of them cause problems. And the ones that cause problems, well, those are the ones we want to get rid of. But you don't want to just get rid of a bone spur because it's a bone spur, right? You want to get rid of bone spurs when they're causing symptoms for a patient. This one's close enough to the nerve root that I want to get rid of it. I don't trust it being here. It could be causing some symptoms. So I'm treating it with the laser. This is the last part of what I need to treat right up here, okay? And there's the arthritic facet joint up there, by the way. That's what was pushing my tube laterally. As I was trying to get into L5-S1, I was getting pushed laterally. And it was really that facet joint. I'll show it to you in a minute. You can actually see it right there. You guys see it? That's the facet joint. Hypertrophied. Right there. Pretty cool, huh? So we come in lateral to the facet and we go straight into the disc. So this part of the disc just below the facet and in the back of the disc, that's called Cambin's triangle. But I'm basically shaving down the hypertrophied facet right there with a laser. Isn't that cool? Now, you can use a drill to do this. Dr. Young uses a drill. He uses a shaver. That's what he taught me as well. But I don't like the drill because it's more dangerous and you can't really watch it working that well. You got to take the scope out. But anyway, that, my friends, is where the pain was coming from at 5-1, and I think hopefully we've rectified the problem. You smell the bone, Luis? I just got to get rid of this last thing here. Huh?
I just quoted Apocalypse Now.
I like that. Yeah. I was watching movies with my son last night, and I said, "You want to watch Full Metal Jacket?" We're done. Yeah. Full Metal Jacket. But he didn't want to watch it. So we watched something else instead, which was actually a good movie.
You gotta watch the Mark Hart.
Which one?
Mark Hart from was filmed in Bogota, Colombia. It's a series. It's about organ transplant.
Oh. Well, we watched something similar. We watched Sicario. Sicario?
Yeah, I saw Sicario.
Great movie. Great movie. The first one. The second one, yeah, I didn't like the second one as much. But we watched Sicario because I needed him to see, you know, learn more about the drug trade and cartels and all that stuff.
This one's about illegal organ harvesting in South America. It's very interesting.
All right, we're done. We're going to take this tube out. And the disc was pretty degenerated. I'm hoping this helps. I expect it to work. And we won't know until he wakes up and tells us. And maybe a day or two before we know. All right, blood loss, 3 cc's. Any questions from the audience?
Yes, we have a couple questions.
All right, let's save them. I'm going to answer them face to face. Just give me a minute, folks. I'll answer your questions. And so type up the rest of the questions you have. But let me just summarize. This patient came to us after having a fusion done elsewhere. And his fusion was done at L3-4. You could see the screws and rods on the surgery. But he developed adjacent segment disease and the L5-S1 disc we hadn't treated, and that's where his pain was coming from. And I just went in there and cleaned out the tear and the inflammation with the laser. So I'm hoping that that fixes the problem for him. We'll know, we should know definitively within a week or two. Now, most of the patients we do this surgery for, literally by the next day they come in, their pain is 100% gone. But about 10% of our patients, they need more time to heal. They take longer. And some of them will still have pain from the actual inflammation dying out from, they had there before. And it takes several weeks, could take even up to a few months. The longest I've ever seen a patient have pain after surgery from their disc is 6 months, but it's very rare for it to last that long. All right, let's hold a little pressure, and we're going to put a nice little Band-Aid on there, and we'll be done. So let's go ahead and show our patients, the audience, how does the Deuk laser disc repair actually work? You know, what are we doing in there with the laser? And then we'll also we'll do a testimonial, and I'll be there shortly.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
And good morning, I'm Dr. Deuk Majan. I'm here with one of my lovely patients from Canada who's visited us because her back has been hurting for 7 years. She's had a herniated disc that she's been kind of monitoring at L5-S1. And finally, it really started bothering her a lot over the last 7 months to a year, causing pain down into her right leg. So she decided to do something about it, and she went to see her doctor in Canada, who then said, yeah, I'll have you see the specialist in 3.5 years.
Yes.
Well, that wasn't going to work for you, right?
No.
Yeah, because you don't want to live in pain for 3.5 more years, and even then, you don't know what you're going to be offered. But she found the Deuk Spine Institute and learned about the Deuk laser disc repair, endoscopic surgery, and you had it done yesterday.
Yes, yeah.
How are you doing?
I'm feeling great today. I have no pain in my back. I have some tight muscles from me having to walk very oddly for quite a while due to the sciatic pain. I must say, this is the happiest I've been in a very long time to be able to stand up straight and go for a walk. Because I'm an active person as is. I ride horses for a living, so having to be locked up in my room for the past while has not been good. So this has felt amazing, amazing.
So you're happy with the results?
Very. I feel very hopeful also to be able to do what I want to for the rest of my life.
Yeah, after we let the disc heal, right?
Yes, full year of nothing, and then we can.
Yeah, I wouldn't say nothing, but you know, horseback riding, it's one of those things where I love horses and I love riding horses. I'm not very good at it, but I'm one of those people you see bouncing up and down, up in the saddle. So I know that it can be rough on your back, and I just want to make sure you give your back a full year to heal. So you can see in your surgery right here, we actually tested your L5-S1 disc with a discogram, which is a test done to verify that that disc is indeed causing your back pain. And when we tested it, you said, and we asked you how bad it was, you said 10 out of 10 pain. And I said, is that your typical pain you get every day? And you said, yes, it is. So we verified the source of your pain was the L5-S1, and you can see the laser was used to clean the tear endoscopically. Your incision was only a 1/4 inch, and there's no need for fusion or metal or artificial discs. This surgery replaces fusion and artificial discs. What are you going to do now that you're feeling better?
Well, it's, again, don't worry, I will take it easy, I promise. But no, I'm going to be, after this, this year, I hope to be the strongest I've ever been, and I have very high hopes and whatnot. My dream is to make actually the Canadian Olympic team for my sport, and that's end goal, and I feel like it's a possibility now.
Absolutely.
Do it.
You can.
Yeah.
We're rooting for you.
Mm-hmm.
And I know you have an incredibly supportive husband who's been by your side the whole time. He's a delightful young man, and I've had time to talk to him as well. So you're lucky you have support from your family
I am
to
very
help you
lucky,
get
yeah,
through this.
Yeah.
Anything you want to say to your fans out there?
Oh, geez, I don't even know where to start other than just this place really can offer you really what either you deserve or what you need going forward to be able to live a happy and good life. And it's amazing to me that literally it was yesterday I woke up from it and I went for a short walk like immediately and I felt amazing. So it's it's very hopeful, and if there's you are suffering from any of it, don't wait, especially for the Canadian system. Come and do this. It's worth it. It's really worth it.
Awesome. And I'm going to be, and my whole team is going to be watching the equestrian sports in the Olympics, looking to see for you to be there.
Yes.
All right.
Awesome,
And
amazing.
of course, supporting you.
Thank you. Yeah.
All right.
Thank you so much.
Congratulations.
Thank you.
All right. Take care.
And I'm Dr. R. Deuk here at the Deuk Spine Institute. I'm smiling because I'm sitting with my first surgical patient of 2023. I don't know if you realize that, but you were the first one of this year,
Okay.
of the new year. Now, you had the Deuk laser disc repair done on your lower back because you had 3 bad discs. And we did that yesterday.
Yesterday, yes.
And here you are, one day later. How do you feel?
And I feel good. I feel good, and the pain that I've been suffering for months is gone. I mean, I was a little bit sore, but that's from the surgery itself.
Yeah.
But otherwise, I feel good. Feel good.
Now, you've had back pain too, on and off for 30 years. We were talking about that. Tell us about those episodes of back pain. What do they do to you?
The first one that I recall was pulling out a sofa bed thing. And I got so far with it, you know, we had company and I was opening up the bed, and all of a sudden I just could not move. I couldn't move. My husband had to practically carry me. So I was out of work for a week or so, and then at the chiropractor, and then gradually it got better, and I thought, well, that's fine. And I moved on. And then, you know, had a couple other times like that. One time I was drying my hair, getting ready for work with the blow dryer going like this with my hair, and all of a sudden, it's like I couldn't move. I couldn't move my arm down. I couldn't, I mean, it was that quick.
Yeah.
And just, I was out again for another week, laying in the bed and doing all that stuff. And then I thought I was fine, but I always, not always, but for many years now, probably at least those 30, I had lower back pain, where in the morning I couldn't bend over to brush my teeth. You know, that would really hurt.
Yes.
So I had that.
Do you have that pain now?
No, I don't think so.
It's gone.
The pain this morning, I was the first time in a long time I've gotten up first thing in the morning and was able to walk and not have that awful pain, because first thing in the mornings was the toughest.
I'm so happy for you. So how is this surgery going to help you in your life?
Well, hopefully once I can at least walk again. I was not able to barely walk with a walker. I was very active in my church and my
So you
community.
want to get active again?
And being in such pain now since July, and this is the new year, I'm anxious to get back to, you know, my life.
Yes, of course. Well, you had 3 herniated discs in your lower back, and you can see in the footage where we went into each of those 3 discs, and I used a laser to clean the tear, where you had a tear in the back of each of those discs called an annular tear, and the jelly from the center was stuck in the tear, holding it open, allowing more herniations to come out. So I got rid of the jelly that was in there using the laser, cleaned out the tear, and now your body will be able to heal that for the first time in 30 years. So I don't expect you to ever have that pain ever again.
Thank you.
You're welcome.
I am so thankful.
Well, you had faith,
I
and
am.
you found us.
Yes, I
and
did.
You did what's right for your body, and I'm excited for you. So
I believe I did. I just kind of was led to you, and it just all went bing, bang, boom, and I didn't ask a whole lot of other people what they thought. I just did what I thought I needed to do
good.
for me.
Is there anything you want to say to your fans out there?
I would recommend that if you do something to your back, that you take care of it early on. You take care of it right away. The longer you wait, the harder it is and the longer it takes.
It takes a toll on your life.
Oh, definitely. It has taken a toll on mine since this summer. for sure, where I have not been able to sometimes not function at all, barely be able to sit in a chair and be comfortable without squirming because I couldn't find that exact place where I didn't have pain. You know?
I don't see you squirming anymore.
No, I'm not squirming. I know. That's great. Sit here without pain.
Congratulations.
Thanks to you.
All right, have a blessed day.
Thank you. You do as well.
This is Dr. Aru Deuk-Majin, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients, and you've traveled from where to the Deuk Spine?
Idaho.
Idaho, with your lovely husband, and we've had a few conversations. She came here to have her back fixed. How long have you had back pain for?
For over 7 years.
Okay. And what kind of work did you do before you retired, if you don't mind me asking?
It was desk work.
All right. And so you had back pain for 7 years. Did you have an injury to your back, or did it just kind of gradually come on?
It just gradually came on. I actually noticed it first in 2015 when I was gardening and I couldn't be up there for 8 hours. I was into it for about 4 hours and I had to take a break. And as time progressed, my breaks got longer and longer, and the amount of work I did in the garden was less and less.
Understood. And you're retired now. So what's it like having back pain limit your ability to do stuff when you're retired?
For me, it's very frustrating. I can't do that what I want to do. So we kept seeking solutions and nothing was working. They did work for a short while, but that short while decreased over time. It was shorter and shorter. My husband does research very, very well. Through his research, he found you. We read that you can fix my back, and you did fix my back.
That's right.
And I thank you.
You're welcome. So when did you have the Deuk laser disc repair done and the Deuk plasma rhizotomy?
I had those done yesterday in the afternoon. I am sitting straighter than I have. I'm standing straighter. I'm walking normal. It's like, wow, new me.
Look at that smile right there. I hadn't seen that until just now. So
well, it wasn't there yesterday.
Yeah, it wasn't there before surgery. And how long have you been not smiling because you've been in pain? I mean, really bad pain. How long has the really bad pain been there?
The really bad pain has probably been over the last 5 years. It's something that was really tough to maintain a positive attitude and try to keep a smile on my face and keep Jeff's hopes up. I tend to be a positive person, but there were times when it does drag you down.
Of course, yeah. It's hard living with chronic pain, and especially with loved ones, they have a hard time, relating. Of course, they want to be supportive, and your husband is a very supportive man, obviously. And he's a pleasure to meet. I know he's an author as well.
Yes.
And so what are you going to do now that you've had the surgery? And you could see, actually, the Deuk laser. Okay. Dr. Deuk-Majin here, and we were just together in the operating room on this last case where our patient presented here at Deuk Spine with back pain, right dead center, right above his butt crack. He had a prior fusion done in the past. You saw those screws and rods. And just for those of you who don't know what a fusion is, there's different kinds of fusion, but basically fusion means you get one bone to grow into the other bone, so they become one solid piece of bone. And what's happening then is you're losing the movement between those bones that God put there for a purpose, for twisting and bending. You're losing the movement, but you're stopping the pain because you're fusing that painful joint and stopping it from moving. But we used to believe fusion was the only way to do that, and now it turns out it's not the only way to get rid of pain. So we can actually get rid of pain with the laser surgery you're watching now from a disc by fixing the disc with the laser. And that's what the Deuk laser disc repair procedure is. It's repairing a painful disc without fusing it and without putting in a metal disc. It's the best way to do it. So you could see, though, he had a fusion done elsewhere before he came to me, and now we're cleaning up the adjacent segment disease mess that fusion causes. We have a lot of questions, so without further hesitation, I'll get to the questions.
This first one, I don't see a question, but I believe it's seeking for advice, and it comes from Brandon once more on YouTube, Facebook.
Facebook, Brandon, thank you for typing in a comment.
They said, been going to the chiropractor for the last 12 months and have made great progress. Advanced decompression treatments for 4 times per week, along with adjustments as needed. Follow-up MRI is scheduled on May the 4th, hoping that my annular tear is closed.
Yeah, Brandon, so thanks for commenting, and I hate to be the grim reaper of bad news, but Brandon is saying he's got a herniated disc, annular tear, herniated disc, been going to the chiropractor for 12 months, great. He says that he's feeling better, which I'm going to just lay out the truth, folks. Whether you go to the chiropractor or you don't, your disc is going to feel better after 12 months, period. Whether you do nothing or you go to the chiropractor, get Vax-D, it doesn't matter. In the end, your annular tear will still be there. It's not going to seal itself. Why does the annular tear not seal itself? Imagine this is the annulus, okay? When you get a tear and the jelly from the center sticks out through the tear, this will be the jelly, all right? There's no way for the annulus to seal around the jelly. It just won't. Now what will happen is it'll feel better. The inflammation dies down over time. As you get less active, you treat it conservatively, inflammation dies down. But the annular tear is still there. The herniation is still there. As a doctor who treats this exclusively, that's all I do, and I've seen thousands upon thousands of annular tears endoscopically, they do not heal on their own without the laser surgery. There is no natural way for them to heal, okay? So, I don't mean to rain on your parade, my friend. Trust me, I'm just making you fully aware your pain will be back again as you start to get more active. Getting a repeat MRI is useless. I honestly don't believe it's of any value for you, but you can do it for whatever reason you'd like to, but it's clinically not indicated. What you should do though is start getting back to a normal life. Do your normal activity, your normal routine, things you want to do. And if the pain comes back, which it will, come to Deuk Spine, let me fix it with the laser, then let it heal for 12 months, and then it'll never come back again. It'll be really fixed. But listen, I mean, I've sent literally 30,000 patients to the chiropractor and therapists. My sister's a chiropractor. I've sent her thousands upon thousands of patients over the years. These tears never heal with the chiropractor. She doesn't even do Vax-D because it doesn't work. All it is a way to get money out of the patients. She knows that. That's why she doesn't do it, because we're ethical doctors. We don't believe in taking people's money unless we can fix them with what we're doing. So most chiropractors are happy to take your hundreds of dollars, $200 a visit for their Vax-D treatment, and knowing full well in their back of their minds that the Vax-D is not what's fixing you. It's time. Your body's trying to heal that tear, and then the inflammation settling down a little bit. But the moment you start getting active again, doing normal activities, sports, whatever you want to do, you're going to re-aggravate the tear again. You're going to get the pain back again. And this is for everybody. It's not just for you. So, Brandon, I'm not trying to pick on you in any way, but I'm just telling you, once the jelly's in the tear, nothing gets rid of it except for cleaning the whole disc out with fusion or doing the Deuk laser disc repair.
These next two come from Carlos on YouTube.
Hello, Carlos on YouTube. Welcome to our broadcast.
First one, they asked, if I have bilateral lumbar foraminal stenosis, why I only have symptoms in one leg? Is there a known reason?
Yeah, Carlos, great question. So you're asking if I'm having narrowing in both foramen, right and left, why do I have symptoms on one side? That's because you're going to get symptoms on the other side. It's a matter of time. Folks, stenosis means narrowing, okay? Narrowing. Spinal stenosis is narrowing of the holes in the spine. Now, if this is normal and it requires you to get to this to have symptoms, then all along the way, you're not symptom, no symptom, no symptom, no symptom, but you still have stenosis. Stenosis, no symptom. Stenosis, no symptom. Stenosis, no symptom. Stenosis, no symptom. Stenosis, symptom. Okay? So stenosis does not mean you have symptoms. Stenosis means narrowing. Lots of people have stenosis. They have no symptoms. But at some point, you're going to get the symptoms on both sides. My advice, come in and get the laser surgery done. Avoid the symptoms. Get the disc fixed properly.
Second question is, I stopped playing soccer because of the foraminal stenosis, because of symptoms and fear. Is it possible to return to play soccer after surgery?
Great question. So Carlos, you stopped playing soccer. I myself am a soccer player, was. Most people don't know that about me, but I was on the United States national soccer team, the junior team. This was back in the 80s. And we traveled to Europe and played against the Europeans. We did very well in Germany and Austria. But I stopped playing soccer. I didn't go pro because there was no pro soccer in 84, 85. It was just starting up in the United States. There was no career. And I chose to go to medical school instead. No regrets. I love soccer. I was a very good player, probably one of the top players in the United States at the time. And I was a striker. I scored goals. I was the top goal scorer on the national team, the junior national team. So, love soccer. Anyway, long story short, you can get back to soccer after your surgery with the Deuk laser disc repair. Now, if you're asking me, Dr. Deuk, if I go get surgery somewhere else, can I go back to soccer? Probably not, because the other surgeons, when they do your surgery, they're going to start taking the bones out of your spine. That's what surgeons do. Laminectomy is when the surgeon takes the bones out of the back of your spine and the ligaments that hold them together. So everything in your spine holding it together, they're ripping it out when they do a discectomy or laminectomy. With the Deuk laser disc repair, we go around your spine through an opening that's already there. We don't take any bones, ligaments, or muscles out. That's one of the main advantages of the Deuk laser disc repair, leaving the spine alone. With everybody else's surgery you're talking about, they're going to take pieces of your bones and ligaments out. They don't tell you about that because everybody does it, so they think it's okay, right? But it's not okay. Now we have a way to do surgery on the spine without taking the bones and ligaments out. So it's actually really bad to do that. If you do the Deuk laser disc repair, 1 year after your surgery, you can go back to soccer. And you don't have to worry about hurting your back again.
Next question comes from XC on YouTube. And they said, is there a schedule posted somewhere of live surgeries? I always miss it or arrive late.
Yeah, so thank you. There is a schedule, right?
Yeah.
Henry posts it every week. It should be on the website. Where is it, Henry?
That's right. I have it right here.
So it's under the live spine surgery?
Yeah, it should be.
Yeah.
This is from Google Calendar, so it should be.
But is it on? It's on Google Calendar, but can people on the website see it?
Let me check. Yeah.
Yeah, so if you're on our website, DeukSpine.com, go to the live spine surgery page, and there's the first window is the YouTube channel, right, with the live spine
Yes.
stream.
Yeah.
Then the second down, if you go down one level, there's a calendar there, and it's got all the surgeries on there. So we do keep up with that. Okay, we just don't know what time the surgery is going to be because everybody's surgery is different. Some people take longer than others. Next question.
Next question comes from Seriously on YouTube. And they said this continued current of irrigation fluid to the outside and inside of the disc and surrounding area, like the nerve root, etc. Does that cause some irritation of the tissue of the mentioned parts or any infection?
Yeah, so great question. They're asking, this person is asking us, I noticed there's liquid constantly circulating during the surgery through the tube around the nerves and in the disc. Does that cause any irritation of the nerves or structures? The answer is no. That's called irrigation fluid. It's used in all surgeries, and its purpose is to remove the debris, the blood, the pieces of disc material, you get it all out of there. If we leave the blood and the disc material there, it's going to cause irritation. So the irrigation does the opposite. It helps prevent the irritation of those structures.
Next question comes from Brandon, once more on Facebook. And Brandon asked, if my annular tear closes, what are the odds of a reherniation? Long-term plan is to continue advanced decompression treatments even after the tear closes as a preventative measure.
Yeah, Brandon, just so you know, your tear is not going to close without proper treatment. And decompression with a chiropractor will never close your tear, ever. I can tell you that right now. So, what's the chance the tear is going to come back? It's already there. I guarantee it. It's still there. And coming back is 100% because it's still there. So, sorry about that. I hate to be the bearer of bad news to people, but rather than worry about giving you bad news, I'd rather worry more about giving you incorrect information. So the correct information is that the annular tear will not heal itself with chiropractic, VAXD, distractions, whatever they do. It literally requires a debridement of the annular tear, and there's only one way to do that, and that's with the laser done endoscopically, and that is the Deuk laser disc repair surgery you just watched. That's what we do.
Next question comes from JMC on YouTube, and they ask, what is mild uncinate spurring? Oh yeah, what is
mild uncinate spurring?
Spurring is present on MRI. This is causing a mild bilateral foraminal stenosis. What is the best nerve pain medication?
Yeah. So what is mild uncinate spurring causing bilateral foraminal stenosis? Your uncinate spurring is not causing, it is causing stenosis, but it's not causing your symptoms. So uncinate spurring means little spurs of bone that form on the uncinate process, which is right here. I don't know if you guys can see it right there.
Yeah, we can see it.
There's a little slope to the back of the vertebral body right there. That's the uncinate process. It is not the cause of your stenosis. A herniation is. And the correct treatment for that would be the Deuk laser disc repair, where we go in endoscopically and remove the herniation that's really causing the stenosis. The uncinate spurring is not your problem. You can live with that the rest of your life without any problems or symptoms whatsoever and have a perfectly normal life. I would not recommend treating uncinate spurring, especially if it's mild. That's not causing any of your symptoms.
I believe this is last but not least. This comes from Timeless 90.
Timeless 90, welcome to our stream.
Yes. My MRI is clear, and the results indicate that I have an annular tear on C5. The pain is debilitating. Do you work on annular tears?
Yes. Yes.
Timeless.
Timeless. Basically, that's the whole purpose of the surgery you just watched. This surgery is for annular tears, and it's to debride. We call it debride, means to clean up the annular tear so that it will heal. And this is the only surgery in the world available for annular debridement currently that I'm aware of that actually works to get rid of people's symptoms. So you've come to the right place. If you have an annular tear in your neck, we can fix it with the laser surgery. If you go to our playlist on YouTube, you can actually go down to cervical, that means cervical spine, Deuk laser disc repair, which is the name of the procedure. You can watch some of our surgeries. You can see us use the laser to clean the annular tear at the back of the disc in the neck. We do it all the time. It's outpatient surgery. You go home the same day. You go home usually about an hour or two after the surgery. And we've done literally thousands of these surgeries over the years. They work every single time to get rid of the pain from those discs that are causing pain. So you came to the right place, and I'd recommend the Deuk laser disc repair for you.
Last but not least, another question comes from XC, once more on YouTube, saying, is the DLDR an option for the resection of other obstructive lesions like paravertebral tumors, or is it only for disc herniations?
Great question. So I think what you're asking perhaps is, so the Deuk laser disc repair is literally just for the discs, but you're talking about lesions to the side of the disc in the paraspinal region where there could be a tumor or mass. Is the Deuk laser disc repair good for that? No, it's not. The surgery is really only for fixing disc problems like degenerative disc, herniated disc, bulging disc, ruptured disc, extruded disc, prolapsed disc, protruded disc, slipped disc, degenerated disc, spondylosis. Those are all conditions of the disc, and that's what the Deuk laser disc repair fixes, annular tear. So a paraspinous lesion, could it be fixed with endoscopic surgery? Maybe that's what you're asking. The answer is sure. I think we could use the endoscope to treat paraspinal lesions as long as they're small enough. The endoscope may be a very good option for patients. Great questions. Really appreciate the dialogue.
We have one more.
Oh, we have one more that popped up.
Comes from Carlos, once more on YouTube. And they ask, how long does it take to get a permanent nerve damage from stenosis? I've heard that this is one of the major risks of this condition.
Carlos, great question. So Carlos is asking about spinal stenosis, which again is narrowing of the holes in the spine, whether it's the central canal or the foramen or the lateral recess. These are just different areas of the spine where narrowing happens. And Carlos is asking, if you have this kind of narrowing, how long does it take to get permanent damage? Because I want to avoid it, obviously. Carlos, it's different for different people, and you can have permanent damage in one day, you can have permanent damage in 1 year, and everything in between. But what I look for that concerns me when I see spinal stenosis that's really bad and you're at risk for permanent damage, that's when the patient gets weakness, starting to get weakness. So for example, if it's in your neck, if you start to get biceps weakness or tricep weakness, if you go to the gym regularly, you start to notice your muscles are weak, that's a bad sign. That means you're about to have permanent nerve damage. The same thing in the leg. If you have a pinched nerve down your leg and you're having trouble dragging your foot or bringing your foot up off the ground and it's kind of catching or dragging, that's a sign of weakness. So anytime I see weakness from a pinched nerve, I get very worried about permanent nerve damage. So don't let weakness or even numbness set in. If you're having any weakness or numbness, get surgery, get it done right away.
And that is it.
That's our last question. Thanks everybody for being here, and I want to thank Henry for doing such a great job with our broadcast. And we'll see you all in 30 minutes for our last surgery. It's going to be a 2-level thoracic on a patient traveling from out of state. I'm not really sure exactly where she's from, but she's here to have the thoracic Deuk laser disc repair, and then we're going to be treating her lumbar facets with the Deuk plasma rhizotomy.
North Carolina.
She's from North Carolina. Okay, very good. So we'll be back in 30 minutes for our last surgery of the day.